At this time, I would like to introduce our speaker, Nan Marie Astone, and she's a senior fellow in the Center of Labor, Human Service, and Population at the Urban Institute here in D.C. She earned her PhD in sociology from the University of Chicago. So again, Chicago is all in the house, and she did that just a few years ago. She has some great experience, and after an NIH postdoctoral training program at the University of Wisconsin, she joined the faculty of the Department of Population, Family, and Reproductive Health at Johns Hopkins. She was awarded the prestigious W.T. Grant Faculty Scholars Award in 1991, and Professor Stone has been a deputy editor of Demography, the Journal on the Population Association of America. And Dr. Stone's principal substantive expertise is in family well-being and adolescent health, and she has a particular interest in adolescent reproductive health, male adolescent health, and fatherhood. And she is a new friend to the association. We've worked with the Urban Institute, but this is great to have a person that's part of our conference this time, and she was gracious to be with us today. So let's give her a warm welcome for the first time being with us, Nan Astone. Thank you so much. There you are.
That's my slides.
Yep.
Good afternoon, everybody. It's a great day for me to be talking about fathers because, as probably some of you, but not all of you know, tomorrow is opening day of the baseball season, which is the time of year when my father and I interact the most. So I'm looking forward to the next 6 months of calling my father every day and talking about the Nats. So I'm going to skip a lot of the slides that I have in my presentation. I apologize for that. I came this morning and realized a little bit about the mood of this conference, so I want to talk a little bit more about the motivation behind the research that I've done. I also want to say that I'm a demographer, a population scientist, so I tend to look at things from the big picture, and a lot of the speakers this morning looked, I think, a little bit more micro. So so that'll be a slight change in perspective. There we go. So I think actually, so how many of you have heard of or read this book, Our Kids by Robert Putnam? Anybody out there heard about it? Yeah. Let me tell you about the vision of America that Robert Putnam presented in this book, and made me, sort of inspired me to think a little bit more about what he painted. The portrait that he paints is one where affluent children have, over the course of the past 30 or 40 years, been the recipients of increased attention from their dads. So if you compare, basically middle-class or rich kids 40 years ago, most of the caretaking was being done by moms at that point. But now, without a decline in mom's attention, affluent kids are getting even more of their father's attention and are profiting thereby. His other portrait is that at the other end of the income spectrum, fathers are, he says, less involved with their children. And so there's an increasing separation in terms of that. And I wanted to take that on because that struck me, although I think some of his data is very interesting, a little bit stereotypical. And so what I looked a little bit into the research, and I found that what's true about research on fatherhood is that we know a great deal about relatively affluent men who live with their children. And we know a great deal about low-income men who do not live with their children. But that's a four-cell table, right? So what do we know about higher income men who don't live with their children, of whom there is a substantial number, and what do we know about low income men who do live with their children? I think it seemed to me that we needed to fill that picture out a little bit, and that's what I've tried to do in the research that I'm talking about today. So let's just review a little bit about the policy research on dads. For the past 3 decades, there's been an increase in stringency of child support payments. In general, the increased stringency is thought of as being successful. But the fathers of low-income, never-married mothers who are low-resource themselves have not shown the same amount of success. That's what policy research tells us. But there have been a lot of evaluations of programs that try to work with low-income fathers, and what those programs generally find is a bunch of important things. First, fathers are extremely eager to be involved with their children. That is something that they want, something that they view as positive. Some fathers face many barriers to employment. Fathers and mothers have complex families, and that creates some tension at times. Another thing that the research has really established is there's a lot of maternal gatekeeping. So there's a lot of mothers of children getting in the way of dads being with their kids as much as they can. And the other thing that's clear when you talk to men who go to responsible fatherhood programs or healthy marriage programs is that they enjoy the parenting classes. They like talking about how to be with their kids. And I've got some of the citations for all of that research. So every indication is that fathers want to be with their children. And I got sort of sad, although I totally enjoyed the presentation by the child support lady, and I think she brought us a set of new facts about child support that we all knew. But I said, why is it that we have an agency that's devoted to getting money from non-custodial parents, and we don't have an agency or any kind of social organization to try to get non-custodial parents to spend more time with their children? Why is that devalued? Why is that devalued? Why are non-custodial parents of both sexes judged by financial contributions instead of by their non-financial contributions, which every piece of research there is tells us are really important? Witness me, I'm 60 years old, and I'm still really excited that I get to talk to my father every day about the Nats for the next 6 months. Fathers are really important, or at least my dad was. It turns out that if you look at the principles underlying responsible fatherhood that the federal government has, the principles are really good. Whether or not each of these principles is acted upon in federal policy is a different question. But the Responsible Fatherhood Initiative at HHS is based on 6 principles. The first is that all fathers are important contributors to the well-being of their children. Okay? And that's the premise we have to start from. Parents are partners in raising their children, even when they don't live in the same household. That's really, really important. And getting custodial parents to recognize that non-custodial parents have a really important role to play is a really important policy goal. The roles fathers play in families are diverse. They respond to cultural and community norms, so we can't expect every father to behave in exactly the same way. Men should receive education and support necessary to prepare them for the responsibility of fatherhood. And government can encourage and promote father involvement through its programs and through its workforce policies. Now, again, listen to that. Through its workforce policies. Like, what are they expecting from men? They're expecting from men money, right? They're not expecting nurturing, they're not expecting love, they're not expecting fun, they're not expecting to talk to their 60-year-old daughter about the Nats. Now, that's the policy research. There's been some basic research that I've already actually referred to. In general, over the last 20 or 30 years, there's been a lot more research on fatherhood. I'd like to call out Jeff Evans in the back of the room, who did a lot to promote that. And the image, as a result of that research, the image of the deadbeat dad, who's usually has undergone a lot of scrutiny and denial by research. Essentially, what research has found is that most men are romantically involved with their child's mother if they're not married to them at the time of the child's birth, and exhibit an enormous amount of involvement with the child around the time of the child's birth. That's what research has found about fathers. So that image is perhaps not out there in the soup in the culture, but that's what research has in fact found. So to sum up this policy research and this basic research, both policy and basic research have focused on low-income non-residential fathers. Both policy and basic research have moved away somewhat from the deadbeat dad concept, as witnessed by those 6 principles of the Responsible Fatherhood Initiative. Basic research, not so much policy research, has uncovered a great deal about married resident fathers. And there's a paucity of research on fathering among higher income non-resident fathers and among lower income resident fathers. And that's what I set out to address. So the questions that I asked in this, and I'm not going to go through the incredibly boring detail of all of these. I'm going to show a couple of slides and then cut to the chase. But the questions I asked was, how does the prevalence of fatherhood and multiple partner fertility, that is having children with multiple mothers, vary by income? How do fathers' contributions to child support and contact vary by income, because those are important? And how do fathers' parenting practices? And this is the piece that is really left out. And I'm going to focus on the parenting practice piece because the others, I think, are better understood. So the data, just to talk a little bit about data, because as a demographer, I think data is really important. The National Survey of Family Growth, which has been since 1980 the major source of information on reproductive health in the United States, started including men in the 1990s. That was a huge fight. There were many, many people who did not think it was important to get data on the reproductive health of men. So it was a huge fight to get men included. And I understand that yesterday there was a presentation about how we're now going to have PRAMS data, data on pregnancies from the father's point of view, and I think that that's really exciting. And one of the things is, if we want to make men's health and men's involvement with their children central to the discourse, we have to collect data on that. And the federal government needs to be pushed to collect data on that. But they were in the 1990s, and they began collecting data on men in the survey, and more recently they've included questions on fathering. So I'm going to skip over this. The sample that I'm going to talk to you about today is the sample of fathers who responded to questions about fathering with respect to a specific focal child. So the father was asked to think of one of his children. I believe it was the youngest, but I'm not sure. So that he would answer the questions very specifically about one child. And it includes men who have a residential child, men who have a non-residential child, and the child has to be under the age of 19. And fathers who had both a residential and a non-residential child could answer both sets of questions. So the men in those two samples could be actually the same. So let me talk a little bit about measures. I noticed I was here this morning for a talk that you had about positive interactions with children. Obviously, when you're doing a survey of thousands of people, you can't observe interactions with the child. You know, if you had a developmental psychologist or a pediatrician here, he would want measures of parenting to be videotapes of the father interacting with their child. When you sample 10,000 people, you can't do that. So we have measures of 3 different dimensions of fathering, which have been identified as theoretically important. Positive engagement means basically playing with the child, working with the child, taking the child on outings, interacting with the child. Warmth, which is the nature of the loving bond between the father and the child. And responsibility, which has to do with, does the father not just play with the child and have a warm relationship with the child, but rather does the father do the chores that are involved in having a child, maybe taking them to doctor's appointments, diapering if the child is an infant, like that. And we know that these practices have been shown to be positively correlated with child development. So we know that these are good things for fathers to be doing. So just to give you a flavor of what the measures are for engagement, they always ask these separately for little kids and older kids. So for younger than 5, did the dad take the child on an outing, have an evening meal with the child, play games with the child, and they always give examples of peekaboo and games like that, and read to the child weekly or more. For older children, the taking on an outing and evening meal is the same, but they ask about helping with homework and schoolwork in general. So I'm going to talk about this. Does this work? Can you see that? Well, basically all of my slides, and this is the only one I'm going to spend any time on, show the same pattern. We have 4 groups of bars. The first 2 are residential fathers, fathers who live with their kids, high income and low income. And then the second set of bars are men who don't live with their children and who are low income or high income. So that's basically how the problem goes. And the findings, I mean, I could walk through findings on engagement with 5-year-olds, engagement with older kids, and I wouldn't bore you with the details because basically the findings are the same. That is, if you look at residential fathers, all residential fathers, there are no differences by income in how fathers interact with their children. The low-income men are doing just fine. And if you look at non-residential fathers, they interact with their children much less, which is not a huge surprise. But by income, it doesn't matter. So higher income non-residential fathers are not, doing better than low-income non-residential fathers. And that's basically the pattern that I found for virtually all of the parenting practices. In fact, there's 2 exceptions that I'll call out. One is that when it comes to responsibility, the low-income fathers who live with their kids actually do more than the high-income fathers who live with their kids. So they're actually more involved in taking kids to appointments and doing things like that. The other difference that I'll call out is among non-residential fathers. The one parenting practice that does seem to be different between the high-income and low-income non-residential fathers is reading to children and helping with homework. And on that, low-income fathers seem to do a little bit less. And that might be an important point for policy intervention, and I'd like to talk about that a little bit at the end. But that's basically what I found, is residential status is the marker. First of all, I want to just call out that non-residential dads of whatever income level are doing stuff. They're doing less stuff than residential dads because they have less opportunity to do that. But they're not doing badly. But the really important point is that income differences are not important here. It's residential differences that are important. So again, I don't want to bore you with all of this. Let me go back, though, to the responsibility, just to show you the kind of things. Taking kids to appointments, for the babies, giving them baths, diapering and toileting, putting the child to bed. For older children, taking child to appointments, taking them to activities, and knows everything or most everything about the child's friends. So that's what responsibility is, how responsibility is defined in this data set. And that's the piece where low-income men who live with their kids are actually doing a little bit more than high-income men, contrary to stereotypes about dads. So in summary, most low-income men live with at least one of their children. Among non-residential dads, low-income men are less likely to see their children regularly. That's true. But among residential fathers, there are no important differences in fathering by income status. Low-income fathers who see their children regularly, and those are the ones that obviously those are the ones that have parenting practices we can avoid, exhibit positive parenting practices, than high-income non-residential fathers. These differences are small by comparison to the findings for residential and non, and the largest differences are found with reading and helping with schoolwork. So, we had no questions on discipline, and we had no questions on co-parenting, which I think are important gaps. So what are the implications of some of this? An important goal of policy and programs for fathers should be increasing contact between low-income non-residential fathers, but maternal gatekeeping needs to be addressed. All of the research that goes and talks to fathers says that they want to be involved with their kids, and so maternal gatekeeping needs to be addressed. And programs have to avoid acting as though the price of seeing your children is money. Okay, they really need to do that, because doing that diminishes the value of time fathers spend with their children. To say it's only worth it if the father does something else is a fundamental mistake, and they really have to do that. And I would also say this about the content of fatherhood programs and the content of work with fathers. My understanding, and those of you who are out there in the trenches can correct me if I'm wrong about this, but a lot of the emphasis in parenting classes for dads talks about discipline, which is certainly appropriate. We want good discipline. But it also talks about child development and where the child is at certain levels. My own view on this, based on this research, is that such parenting classes could focus a little bit more, like we were talking about this morning, on specific parenting practices that are positive for children, instead of sort of taking this very, very big view of, where the child is in development. And I think I work with a fatherhood agency that is doing fatherhood programming in New York City. And one of the things that they talk about is there's sometimes an assumption, and I know I'm talking to a healthy start here, so I know you're all talking about little kids, but there's sometimes an assumption that the kids are little in fathering programs, that you're talking to new fathers. Well, in fact, you might be talking to new fathers, but they might have older children. And so I think the parenting practices of helping with homework and reading to children are not being emphasized as much as they might be, because that's the only place where I'm really seeing differences. And I think that that's an important parenting practice that we should be talking about, not just discipline and how to engage with your child. And responsible fatherhood programs should try to address co-parenting and include the mothers of their children when possible. And some attention here needs to be given to higher income non-resident fathers who are not doing as much as higher income resident fathers. The differences are the same. And once again, I want to call attention. I'm a sociologist as well as a demographer, so I tend to think in systemic ways. The higher income fathers are somewhat more likely to be paying child support than the lower income fathers. That difference is not as big as you would think, but it's there. And so the message to those fathers is, you're doing enough. Well, they're not, if they're only giving money. They're not doing enough. Children need, 60-year-old children need to talk to their dads about the gnats. So we really need, from a research perspective, from a policy perspective, I understand that policy and programs tends to focus on particular populations. But the basic research, and maybe some of the policy, needs to be talking about father involvement among higher income non-residential fathers, because they're doing as well as the low income fathers who appear to need our attention and intervention. So why don't the high income fathers need that? And programs for low-income children need to avoid being mother-centric, since fathers are often in the picture, and if they're not, it would be good if they got there. So, do we have some time for questions? I I hope that was somewhat informative, and I'm happy to take your questions. No questions? No.
I'd just like to know the name of the study that they came out of.
Oh, it's called the National Survey of Family Growth. It's the major source of information about reproductive health in the United States, has been since the early 1980s. It has some limitations, so let me just state them. Clearly, in this talk, I didn't emphasize the data about child support and contact with children, because I feel like that's, been done, and certainly this audience is very aware of it. But it is a younger sample. So it's a sample of men 15 to 49, and that's because it started out as a sample of reproductive health of women, and they felt like women had no reproductive health needs after they turned 49. The result of the survey, by the way, focusing on that, is that there is no systematic population-based knowledge of menopause in the United States, because they don't ask data. So that's not something of concern to fatherhood folks, but it's of concern to postmenopausal women. And they followed that with the men. They did it 15 to 49. And I mean, the really fascinating thing here is that the idea was we didn't have to have a survey outside the childbearing years for women, but as we all know, the childbearing years for men are longer, but we still cut it off at 49. With all of that said, it's a great data source. And it's publicly available. You can download anything you want.
I'm just wondering if you have if you've been able to dive deeper into this idea of maternal gatekeeping, because that's something that comes up a lot, but I have yet to hear any concrete strategies for starting to break that down.
Well, I know of one concrete strategy that I heard about recently at a child support meeting that I attended. There is a judge, I believe he's in Minnesota, and he calls his court co-parenting. I don't think he calls it co-parenting camp, but he has some name that I can't remember. And I can get this information to Ken to spread it out to the membership if you need. But he has been remarkably successful in getting couples who were pretty hostile to each other. So, I mean, by definition, we're talking about couples that the court had to intervene with. So these are not couples who are still romantically involved and who are very lovey-dovey. And he's gotten a phenomenal response rate. It was a randomized control trial, so he has really good data. And when they come to his court, they don't just talk about child support. They make an agreement on co-parenting, like what will be the process of co-parenting? What will the dad do? What will the mom do? Recognizing that most people, certainly not me, do not realize at the time that their infant is born what parenting will consist of when the infant is 16. They actually insist that the parents put into this agreement processes by which they will renegotiate this as the child ages and as their own circumstances change. They identify people in their lives who might serve as mediators if things get tense down the road. It's an incredible project, and that judge has pretty much done it on his own. But I mean, what he argues, and he's passionate about this, he's just a fascinating man, great person next year for your conference. What he talks about is it's ridiculous to only focus on child support when a couple comes to court, as if that's the only thing that matters. And by doing this agreement, it calls attention to the fact that dads and moms, by the way, I mean, it has stuff that the mom should do, that a co-parenting agreement, this is something going forward. As I said, he's got great data because he actually did a randomized control trial. He put half of his people that were assigned to his court in this group that got this, and the other half, just got the normal stuff. So he's got very persuasive data, and that's the best I've known about doing it. There's not a lot of research on maternal gatekeeping. I would certainly like to do some. That is my hope, to do some in the future. I haven't had a funding opportunity to do that. Yes?
Yes,
Could we bring the microphone here so everyone can hear the question?
Okay. I offer the microphone to you. Come to you next. Thank you. A couple comments, more of a comment than a question. So the survey of family growth is by our National Center for Health Statistics, and it took 30 years to include a sample of men. A long time, but at least they did it. And so it's been around since 2002. But what I wanted to say is they really want people to use the male data more. And so they're currently will be looking at revisions to the questionnaire. So if there are measures related to fatherhood, and I can follow up with Ken and Deborah, let's get the feedback now. And so when the next cycle goes in, we can make some modifications either to the questions or to the responses to the questions. A lot of times there's something that's a very simple change they can make. And if there are certain analyses that you guys want run, let me know, and we will get them run for you, if that would help.
It's a great source of data. As will the PRAMS data when it comes along.
Thank you for the plug.
I just have one question.
Sure.
You had mentioned that that with respect to young children, that the programming is mother-centric, and that was one of your key bullets. I'm wondering, again, kind of pairing off the question that was asked earlier, strategies that you think about, how does this idea of broadening it from a mother-centric perspective get implanted or embedded in institutions and practices, both institutionally and from a policy perspective? You have any thoughts?
I do have a few. And they are not informed by data, so can I just put that disclaimer out there? But some of the remarks that, some of it comes from, I was talking about this at lunch. I've done a little bit of research on men's reproductive health, and boys feel very alienated, young men, feel very alienated when they walk into a reproductive health clinic, see pictures of moms all over the walls, see handouts for moms. They go to the vending machine while they're waiting, and the vending machine only has diet soda. The magazines that are lying there are fashion magazines, and the men's room are 3 floors away. Okay, so this stuff matters. These practices matter. So one issue, I think, is to make things less mother-centric, is to have an atmosphere that expects men. An atmosphere that doesn't specifically make a man feel like he's a stranger in this place. That's one thing. Sometimes it can be as simple as when a parent is filling out forms, they'll have something like name of mother, like as if the mother is the only parent that could come pick the child up. So I think that I'm talking now about practices. I don't think practices are unimportant. Institutionally, though, I go back to what I said. I mean, there's no federal entity charged and associated daughter state entities associated with trying to get men to be more engaged as parents with their young children. Until we have some sense of urgency about this, I don't know. And the real, and I don't want to minimize, I just want to say here, I don't want to minimize the fact that there are moms out there who need money. That's not at all what I want to say. That's true. That's absolutely true. But we've taken that fact and we have implied to a whole lot of men that what they have to contribute to their child is money. And in fact, that's not enough. I mean, he can give all the money in the world. I mean, a kid is going to miss their dad, even if dad is giving money. I mean, and we just don't have a sense, an institutional sense that that's, and my own personal feeling is we do have that about women. We do have that about mothers. That it's important that mothers be nurturing and caring. And a mother who's not that feels a stigma. I don't like to improve, but we need some form of stigma against dads who don't interact with their babies. Yeah.
Are you aware of any data or research that shows fathers being sort of discriminated against home loans or car loans because of child support? So let me paint that picture. When a father's on child support, that's considered debt. So it counts against his debt to income ratio. So are there any studies or research that shows that? That way we can use that information as we approach that subject with lawmakers?
I don't know of any information, any research that's been done. I do know that child support debt is not treated like other debt in the United States. It's debt normally gives you a good credit, fulfilling debt gives you a good credit score. You get a mortgage, you pay a mortgage, oh, you paid your mortgage, you have a good credit score. Oh, you paid your child support doesn't get you that. So that would be a change we could make. That, oh, you paid your child support, that means you're responsible and, I'll lend money to you. Certainly the percentage that we think men can pay is too high. The proportion, but I don't know of any. There's not as much research on all of this as there should be. I'm sorry. And you also have to say, is there no research, or does Nan not know of any research? That's, possible.
Okay, that concludes questions. Thank you very much, Dr. Stone.